Do you prefer the online approach and application process or a face-to-face process?
Actually, to me, it really doesn't matter how the application process goes, because in the end, you will have to meet the applicant face to face and have a more in-depth interview. So for the application itself, to fill it out online or face to face, it doesn't matter to me.
Okay. What are some good resources for job hunting for a PT or PTA?
First, to be part of the Physical Therapy Association, the APTA and or the FPTA. They send you magazines. They normally your name is in a database, so there's a lot of the clinics around us will get your names, and they will send you cards or any type of job offerings, or they call you. Also, word of mouth is very good, especially if you know somebody and they can tell you a little bit about the facility. And to know people, so to know your colleagues, PT and PTA colleagues around you in the areas that you live.
Okay. How important is a first impression in an interview?
To me, I know people say it's very important. First impression is always a very important impression, but to me that's not the most important, because most people are very nervous on their first impression. So yeah, as long as the person is not dressed inappropriately and they come in totally unprepared, I always say first impression is it helps, but it's not the most important. You meet them again for a second and a third interview, and that's where you get your you feel of how somebody is.
Okay. What are some key questions you would ask in an applicant?
Their schooling, where they went to school, their coursework, what type of courses they have done since they graduated, and if it's a recent graduate, you can't expect them to have a lot of coursework, but I do expect while they're in school they get the opportunity to, because as a student you can sign up for the APTA and the FPTA for a lot cheaper, and you get the opportunity to go to classes. So that is, to me, that's important, because that shows initiative, and it shows the compassion they have, or the passion they have for their job. So schooling, coursework, experience is very important. But again, if you're a new grad, you don't have that, but then the interest and the commitment to the job, the interest that you have in your field and the commitment to the job. To me, what's also very important is family life. Somebody who is settled in this area is probably more than likely going to stay with you for a while, instead of having to move to a different city, because it's very hard to have to train somebody every year or every 2 years. So it's also very important how they're settled in the area.
Are there any keywords or responses you would look for during an interview?
Yes, commitment. How committed will they be to your facility? Passion, the passion they have for their job. Some extracurricular things that they do that has to do with their profession. The person that I interviewed should be able to tell me what their strengths are, and also what their weaknesses are. So that means they have a good, they have some good insights on what they can and cannot do, and also initiative.
Okay. How important is a resume to the interview?
Very important, because you don't have a lot of time to go and ask them all these questions, even in your second or third interview. So to me, it's very important, so you already kind of have an idea of what the person is like.
What are some key things you would want to see on a resume?
Again, their schooling, their work experience, their coursework, what they can bring to this facility.
Okay. How important is confidence for an applicant to have?
Very important, but not too confident. Because I know for a fact that if somebody comes in and they're not even sure that they can do the job, that means their confidence level is very low, then you probably wouldn't hire them. But you also don't want to have somebody in who is so confident that you're afraid that they may not be able to learn anything from you. So yes, it's very it's very good to have somebody with a healthy amount of confidence, but I shouldn't get the feeling from the applicant that they know it all.
Okay. As an applicant, what questions should I ask a potential employer to get a good idea of what the work environment might be like?
First question would be, what is your policy with one-on-one patient care? Do you see more than one patient at the same time? Because that is to me, that is basically a way of trying to find out if you are if you're going to be able to spend some time with your patient, or if they're going to push you through. And it's also a way of to see how committed they are to their patients. You want to ask how they market their program. I have had colleagues, friends, who when they go to a different facility, they would have to help market, which is not a bad thing to go out and show your face, but if you go to a place, they should already have a marketing program in place, and not count on the therapist to do it all. Opportunities for learning. It could be in-house, like for example in the hospital here, we have a lot of credit hours that we get from the hospital because they put on some courses, or it could be out-of-house continuing educations.
Okay. What's the appropriate way to bring up the topic of money during an interview?
During the first interview, I would never bring up the topic of money, personally, because that almost seems to me that the most important thing for you is the money. And I know that is what we work for. We won't go for a place that is not going to offer us anything or less than another place can. But at the same time, you don't want to come over as, okay, that's the most important part of what I'm here for. So I would say, if you are interested in that place and the persons and they are interested in you, they will call you back for a second and a third interview. When they're about to give you the job and make you an offer, that's when you, personally, that's where I would start talking about money. And if they really would like, for you to start there, they will make some accommodations, or they'll try to get you what you're asking. If not, then I would say if you cannot come to a good agreement, that it's not the place for you. But I would not ask for money in the first interview, maybe in the second or third.
Okay. What are some deal breakers that you might encounter from an applicant?
What I have seen here, first of all, people are more interested in money, so the first thing they ask for is how much is this job pay. People are more interested in vacations and their days off. From the company side, that would be a deal breaker if I interview with a company, is for me, it's definitely if they expect me to work with more than one patient at the same time, because I started this and I became a physical therapist because I love working with people and I love to see the progress that I make. If you work with 2 and 3 patients at the same time, it's very hard to keep an eye on whatever they're doing while you're working with them. So that would be, for me, a deal breaker if I have to work with more than one patient at the same time. Also, if there's no learning opportunities, if they expect you to pay for all your classes or courses, that also is not a great thing. And the other thing is poor benefits. If they cannot give you good benefits, I would keep looking.
Okay. What are some useful tips to be successful when looking, applying, and interviewing for a job?
From what I've seen here at the hospital, what can turn somebody off is if they try too hard. Always stay very professional. Know your strengths and weaknesses. Don't apply at a place that you know you're not comfortable with the setting. For example, don't apply for a neurological facility to work at a neurological facility if you are more interested or you have more orthopedic experience behind you. And definitely don't come over like you know it all.
Okay. Thank you, Kathleen.
You are welcome.